Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Wednesday, April 1st, 2020. My name is John Bradford. I'm a small business owner right here in North Mecklenburg. I'm also a former member of the North Carolina House of Representatives, and it's my honor to be the briefing call moderator for this series of calls. The purpose of these calls is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to help update, educate, and support the North Mecklenburg region during the outbreak. Yesterday, the president extended his initiative to slow the spread. It was 15 days to slow the spread. Now it's called 30 days to slow the spread. So technically, this is day 16. On the slide, you see an iceberg. And the reason I put an iceberg here is because from all indications, there's much to come here, folks, and the next 2 to 3 weeks is going to be incredibly important. So think of an iceberg and what's below the water, and that's what's coming. If you feel sick, stay home. If your children are sick, keep them home. If you're an older person, stay home and stay away from other people. I have encouraged, all my relatives who are older than me to please take this very seriously, including myself. President Trump announced social distancing is required through April 30th. This slide I actually grabbed from the Claremont colleges. They show we're trying to flatten the curve, which is the blue curve. The red curve is without protective measures. Of course, we want the blue curve with protective measures. And social distancing is maintaining 6 feet of distance at all times when you're in public. There is a screening tool developed by Apple and the CDC. It is a screening tool, so it's a software tool, but it allows you to do it for yourself as well as maybe to do it for someone else. So if you have someone close to you and you want to try to help them. It obviously asks a lot of questions. It's just a tool to try to use as a guideline. And so right here on this slide, you can see it's apple.com/COVID-19. As of yesterday, this is every day at 4 p.m. a new update comes out from the CDC. You can see the heat map of the U.S. In the top left corner, I have the small heat map from Monday's call just 2 days ago, and you can already see the difference. States are starting to get very dark color, so the counts are definitely going up. There's been 163,539 cases with 2,860 deaths here in the U.S. And again, that's old data because this was from 4 p.m. yesterday. And from a federal update, the CARES Act, the Coronavirus Aid, Relief, and Economic Security Act, was signed into law by President Trump on Friday. Stay-at-home orders are in place for at least 31 states. $84 million is being spent for 8,000 ventilators, of which 1,400 will be delivered to providers in early May. 14,000 National Guard members have been activated to help states distribute personal protective equipment. And we're seeing some great involvement from some companies such as MyPillow, Jockey, Honeywell, Procter & Gamble, United Technologies, and Raytheon stepping up their production and creating PPEs and kind of doing things different than what they normally do. The CDC has issued strong advisory travelers to New York, New Jersey, and Connecticut. So I would encourage you to please stay away from those states. Those are hot spots. And the Centers for Medicare and Medicaid Services has announced expansion of its accelerated and advanced payment program for Medicare participating healthcare provider and suppliers. U.S. Senator Thom Tillis, I went to his website. He's got a great website where he's pulled everything together regarding the CARES Act. It shows that there are one-time checks for North Carolinians. You can see on the slide right here your eligibility based on income threshold, as well as how much you would be eligible for on a child basis, per child basis, an individual basis, or under a married couple status. Rumor control, FEMA has updated their website. There are 2 new rumors out there, so I'm going to just cover the 2 new ones. One of them is, are there vaccines to prevent or medicines to treat COVID-19? The answer is no. There's currently nothing specifically approved by the FDA. So if anyone is trying to tell you that they have some sort of misleading treatment, please, try to, don't trust them, right? Verify. Do not be fooled. There is nothing available yet in terms of a treatment. And then here's another one. I'm on Medicare, and someone offered me a COVID-19 test if I provide my Medicare information. Should I accept? And the answer is no. If you receive any calls like this, no, it's a scam to try to collect your personal information. Beneficiaries are being targeted in a number of ways, including telemarketing calls, social media platforms like Facebook, door-to-door visits. Do not give out your Medicare information, your Medicaid information, or Social Security numbers. These are scams. So please, we just cannot stress that enough. As you see, we are still under a state of emergency in North Carolina. Here's our call-in number, as well as a 211 assistance and a number you can text. Also, North Carolina numbers as of this morning at 11 a.m., 1,584 cases in North Carolina, 9 deaths, and 204 current hospitalizations. 78 counties are impacted in North Carolina. That's up from 71 on our call on Monday. Yesterday, Executive Order 124 was announced by the governor. Utilities are prohibited from disconnecting people who are unable to pay during this pandemic for at least the next 60 days. The order also encourages companies like banks not to charge overdraft fees, late fees, and other penalties during this crisis. We need volunteers. If you are a clinical physician, some sort of clinical support or non-clinical support, and you want to help, here's a website you can register. North Carolina needs your help. Unemployment, if you're an employer or an employee or a former employee who has reduced hours or you've lost your job, our North Carolina Department of Commerce has a website you can go to with a lot of Q&A to help you. Mecklenburg County data, as of a few minutes ago, we have 418 positive cases, and the first death was Sunday the 29th, 60 years old, here in Mecklenburg County. They did put the heat maps back up, although they've been updated March 28th, so a few days behind. What I thought was interesting here is 41% are ages 20 through 39, and 34% are 40 through 59. So this is impacting all age groups, not just over 60. We're under a stay-at-home shelter order here in Mecklenburg County, and just know that our order in the county may be more stringent than the governor's order. The most stringent order always has authority. So make sure for stay-at-home orders, you know what Mecklenburg County says versus the state, and apply the more restrictive order. That said, Congressman Murphy, he has been a wonderful panelist for us. It looks like, oh, he's on. That's awesome. Thank you, Dr. Murphy. He's the only practicing physician in Congress. He's from a Davidson alumnus. He's from the North Carolina 3rd District. Dr. Murphy, we'd love to hear an update from you.
John, thank you very much, and thank you for doing this. Again, as I've said before, education is the key during this period where we're not really able to get out and talk with one another, and so putting out these broadcasts really is a fantastic thing. I'll try to be brief. I just got through a hour-and-a-half long conference call, and Dr. Fauci was on it for a good 45 minutes, and then we talked about with some small business leaders. Bottom line is, as they said yesterday on the president's briefing, we are expecting a lot of fatalities from this. If you look at the lethality rate of the flu, which is normally about 0.1%, all models are predicting, once all is said and done, this to be about 0.66 to 0.7% of people who contract this that will succumb to this. So if you look at some of the statistics where we have anywhere from 25 to 40,000 individuals that die every year from the flu, you just extrapolate those, in some ways a best case scenario puts us between 100 and 200,000 people dying. So it's very sobering statistic. That is in the best of circumstances. That's with all mitigation working through. So, I've heard a lot of things. Well, our county's not involved. We're good. It's just a matter of time. And if you take your foot off the brake, then bad things will happen. So this is serious. We will get through this, but we're in this for the next 6 to 8 weeks, I truly believe. Just throw in one thing. I had a very good conference call with our Small Business Association folks. They put out some direction yesterday. Just a few points here. The framework is out. Either if people go to SBA.gov, the Small Business Association, or to the Department of Treasury websites, they can see where they can get these 7A loans. And so the interest rate is said in the legislation not to exceed 4%, but it's really about 0.5%. There's a big difference. Maturity is going to be about 2 years. Some have said that's a too short time period. That may be changed. One of the hard parts that came out yesterday, direction from the Treasury, is they said that 75% of the loan has to go towards payroll. Now remember, this is a payroll protection program. And so rent, utilities, interest are going to be the other 25%. I will tell you, I'm on the phone with several of our leaders trying to get some change in that, because I think that's a little bit onerous as far as small business owners. The speed with which this has been done is unparalleled. This Friday, we are hoping that small businesses will be able to access their money. And then by April the 10th, we're hoping that independent contractors, those who are self-employed, gig workers, should be able to access money from these loans. And so, you know, I swear the folks are really put this stuff in overtime. You know, this is one reason we are not crazy about the government running things, but in this particular circumstance, I think so many individuals have stepped up to the task. So, guys, we're in this not only for the short haul, but for the long haul. And a lot of good people just on every level are working towards this. And John, again, I thank you for doing this. This is great for the people in your district. So God bless, and thank you.
Thank you, Congressman Murphy. Appreciate you being a very consistent panelist for us, and we appreciate your work for our state and our country. We are now moving on. Every Wednesday, we're lucky to be joined by Thomas Stith III. He's the District Director for North Carolina for the United States Small Business Administration. So he's our SBA contact. And Mr. Stith, we'd love to hear an update from you. I know your office has got to be really busy right now.
Yes, John. Thank you again for the opportunity to participate. And thank you again as well for your leadership in ensuring that our communities have the important information that's happening almost on a daily basis now. I wanted to give just a brief update from last week's information in relation to the economic injury disaster loans that are now available for every small business to apply for throughout North Carolina. You know, on March the 18th, North Carolina was declared, and that means declared in every county to be eligible for small business to apply for EIDL loans. The enhancement that has taken place since last week is there is a component called Emergency Economic Injury Advance. So if a small business is applying for an economic injury disaster loan, they will also have the opportunity within that same application to request an advance up to $10,000. That $10,000 is forgivable. So that individual business will receive that $10,000, and the goal is within 3 days of becoming eligible that those disbursements will be made to that business. And regardless of whether the business continues and is qualified at the end of the loan process or not, that $10,000 will not be required to be repaid. So that's an additional benefit as a part of the Economic Injury Disaster Loan Program to provide a much more immediate economic revenue for small businesses. And so that we've also enhanced the website. As I mentioned last week, that's sba.gov/disaster. If you want to go direct to the EIDL site. And if businesses had already applied for an EIDL loan and now feel that they are eligible for the economic injury advance, they can go back into that same web portal, reapply. It will not disturb their existing application as far as where it is in the review process, but it will give them the opportunity to apply for this injury advance up to $10,000. So I want to make sure all small businesses are aware of that the website and web portal has been enhanced to be a lot more user-friendly and a lot more expedient in getting through the process. So that is one enhancement that is a part of the Economic Injury Disaster Loan Program. John, as you mentioned, and as Congressman Murphy just mentioned, the CARES Act was passed on March the 17th. And as a part of that CARES Act, there is a program called, and everything has an acronym, it's PPP, Paycheck Protection Program. And the Payroll Protection Program is a new loan program that is designed to help small businesses with their payroll and other business operating expenses. It will provide critical capital to businesses It doesn't require collateral requirements or personal guarantees. There are no SBA fees, as in with other SBA loan products. And all of it will be 100% guaranteed by SBA. These loans are not direct with SBA, but they are with our lending partners. So your local community bank or regional bank or national bank will be the actual interface for small businesses. And there is a forgivable portion within these loan proceeds. If a small business utilizes these loan proceeds to cover the first 8 weeks of payroll costs, rent and utilities, and mortgage interest, that portion of the loan will be forgiven. Therefore, the small business will not have to repay that loan. These loans can go up to $10 million, and the initial loan payment has been deferred for the first 6 months. So if the person maintains their workforce, and that's what it's designed to do, to keep individuals in our communities working and allow businesses to be able to afford to have these individuals working, for that first 8 weeks that is dedicated to that portion of the loan will be forgivable. There is an additional website if individual businesses are interested in the Paycheck Protection Program, and that is sba.gov/coronavirus. That site will actually give you all the available programs in relation to the COVID-19 virus that we're all having to respond to. And so that's sba.gov/coronavirus. That will also give you a link to the injury disaster loans. And in closing, I'll mention 2 other opportunities. There is an Express Bridge loan currently available for small businesses to apply for. That is designed to help, once again, provide a quicker turnaround on the loan application process for small businesses. Again, they will deal with their hometown lender. Those loans can go up to $25,000. And they, again, are designed to provide economic infusion while the business is waiting for their idle loan to go through the processing. And then finally, there's a small business debt relief initiative that was a part of the CARES Act. It is designed to bring relief to existing SBA loan recipients. Our flagship loans are 7A and 504, and also microloans. SBA is actually paying that principal and interest for those loans for the next 6 months if a business applies to that and is approved for the small business debt relief. So I know a lot of information, but the main sites to remember for the disaster loans is sba.gov/disaster. And then for the recently passed Paycheck Protection Program, small businesses can go to sba.gov/coronavirus. Again, these initiatives are designed to put economic infusion into our small business community, because given the importance they have not only in our economy, but in our communities. These programs are designed to provide immediate relief in some cases and potential relief as you go through the loan process. So John, again, thank you for allowing me to participate today, and look forward to being continued involvement with the show and providing information as it develops with SBA.
Thank you very much, Mr. Stith. Very, very helpful information. We appreciate you, and we look forward to hearing from you next Wednesday as well. I'm going to skip Dr. Faircloth. I will circle right back with you. I need to go to the towns. They have a call here shortly, so I'm going to go to Cornelius Mayor Woody Washam. Woody, you have the mic if you have a quick update for us.
Okay, thank you, John. I appreciate that. Just one addendum to the SBA comments. I was also on a call this morning from my banking perspective with the North Carolina Bankers Association. There is a high level of lack of information and confusion on the part of banks out there. continues. We're still trying to get some clarification. So I'll just tell you that once you call your banker, the programs are great, but the application where the rubber meets the road with your banks is still in need of a lot of clarity. So more to come on that. I just thought I'd throw that in. So on to Cornelius related to this particular topic. As of this morning, with the 452 cases in Mecklenburg County, it appears Cornelius is in the 4 to 5 range in terms of numbers here in our town. We're highly focused on educating our residents on the required social distancing at our parks and our lakes and our greenways so that we can keep them open. We certainly want to do that, but folks have got to abide. Mecklenburg County's had difficulty with compliance as well, which could, hopefully not, but could lead to some more restrictions. We're hosting, I want folks to know this, our monthly coffee chat this coming Monday. I'll announce it again on Friday, but we're hosting it virtually this time on Zoom. And we're going to include, much like this conversation, a representative. We believe it's going to be Senator Tillis from the federal level, one from the state. We have Dina Dioria, county manager, lined up to be a part of that. And then our town manager and myself will be the other participants in that. So more to come. That's at 8:30 on Monday, April the 6th. So tune in. Hopefully some updated information fresh off of the weekend there. I want to continue to update you on the wonderful acts of kindness that are going on in our communities. Some additional things that's occurred is actually today, Cornelius today, Dave Yoakum and the folks there just dropped off sandwiches and biscuits from Bojangles for our police department. It was made note that a local resident has put out empty bins in her driveway and is encouraging everyone on her adjacent streets to drop off non-perishable foods. She sanitizes everything and delivered it all. She had collected to the Second Harvest and the Neighborhood Care Center here in Cornelius. So great acts of kindness continue to occur. Please let us know about those. You can report those to Town of Cornelius at cornelius.org. So that continues to be the way to report those wonderful acts, as well as any other communications you might want to have with the town regarding this topic. So thank you, John. Appreciate you continuing this dialogue.
You bet. Thank you, Mayor Washam. I'm going to just finish the towns here before I go back to Dr. Fairclough. So we have Huntersville Mayor John Anarella with us. Mayor Anarella, would love to hear an update from you on Huntersville.
Okay, well, I'll be real quick. I'll always reiterate what Mayor Washam has stated. In addition, the county has come up with a little bit more stringent rules for playgrounds and parks. The town of Huntersville will follow their lead on that. Huntersville right now, I believe, has 6 to 9 cases out of the total 400 plus. We still are looking for people to help out, either at Angels and Sparrows or some of the other charities that are providing food to our citizens. CharlotteMechResponds.org is another website you can go to check out what's going on within volunteering in the county. And then a couple of things that I'm going to really state emphatically here, that how you act at the big box stores is going to directly affect what type of abilities we'll have to continue to go to the big box stores. So please be mindful of everybody in the store, especially the workers. Be mindful of all the signage and adhere to what criteria the particular stores are using to have the distance between each other and social distancing, because I think there might be more stringent measures coming down the line. Electricities, and as both a Cornelius and Huntersville provider to certain residents, The governor came out yesterday and said you can't shut people's electricity off in this time. So obviously we will adhere to the governor's mandate. And then finally, I wanted to continue to stress that our first responders are being affected by this COVID-19 disease. I don't think it's particularly being reported, but unfortunately, one of our sheriff's deputies died today, and they're coming in contact with people. So if you feel like you've been close to somebody, or you know somebody, or whatever, please tell our first responders prior to them coming, or as they come to help you with whatever your need is. So that's all I have, John.
Thank you, Mayor. Thanks for your leadership, and our thoughts and prayers are obviously with that first responder and his family, or her family. Let's see, moving to the town of Davidson. Anyone from Davidson on the call? Just for all our listeners, I have been very consistent extending invitations to both the mayor and the town manager, and I know everyone's busy right now, so all we can do is just continue to invite them. Is there anybody on the phone from Davidson? Final call for Davidson. Okay, let's move up to Dr. Jack Faircloth. He's a medical doctor right here in Huntersville, works for Holston Medical Group. He's on the front lines. Dr. Faircloth, would love to hear an update from you, sir.
Sure. Thanks, John, for your leadership. This is a wonderful opportunity. Today, we'll just talk on how severe this COVID-19 looks to the medical community. What are the characteristics of the patients getting hospitalized? What's the current science on asymptomatic carrier rates? What are the testing criteria as of today? They've changed. And then, is there a magic bullet? So first, the severity of COVID-19. We've had time to analyze data, and it looks like 81% of patients have a mild disease. That is good news. We also, though, have a percentage that has severe disease, and that is 14%. That leaves 5% that's critical. So even though the congressman mentioned our fatality rate looks like it'll fall somewhere around 0.7% of those who get it, we are still seeing severe disease at 14% and critical at 5%. Are those patients that do get hospitalized, are they healthy, or do they also are they sick with other problems? The science says that 94% of those who end up hospitalized with COVID-19 have at least one other chronic disease. There's a long list of diseases that put you more at risk. It's severe kidney disease, heart disease, diabetes, immunosuppression. But the key point is that for 94% of those patients in the hospital with it, they do have at least one other chronic disease. I mentioned on an earlier call that the asymptomatic carrier rate was 50% in the NBA study, in the cruise ship study, and now we have the third in Iceland study that says that's true. However, follow-up studies on those particular patients, if you follow them for 2 weeks, all 50% of the asymptomatic at the time of testing do not stay asymptomatic. So it looks like at the end of the incubation period, there's really only 18% that will be asymptomatic the entire time. Now, that is a high number with such a severe disease. Also, it is they have just as many viral particles shed when they're asymptomatic. So it is truly a very contagious disease. Moving on to testing criteria, we still want to see a fever if you have it, plus cough or shortness of breath. But then from there, we're not only just testing immunocompromised lung disease, but we're now added to that list emergency department patients, hospitalized patients, healthcare workers, first responders, the children that live with healthcare workers and first responders. And so we are trying to decrease the asymptomatic spread through those that are on the front lines. Lastly, Dr. Burke said it well, there's no magic vaccine or therapy. There are, however, magical behaviors, and they are still, and they're scientifically proven: social distancing, hand washing, and don't touch your face. There is discussion in the task force and in the CDC about whether to add a mask recommendation for everyone. Keep in mind that if that is done, they will not replace, a mask will not replace any of those other magical behaviors. And I believe the mask for all of us is coming, but it's not official. If so, please keep in mind the type of mask that's recommended, since healthcare workers are still in certain areas short of the N95 mask. So that's my report for today. I do want to just thank everybody who's done the magical behaviors, as we're calling them, or the social distancing and such. It seems to have kept our area with a very low fatality rate, and we just pray we stay that way. Thank you.
Thank you, Dr. Faircloth. And again, we thank all of you on the front line, everyone in the healthcare community. So thank you very, very much for your leadership. Moving to Mecklenburg County Commissioner Pat Cotham. Pat, thanks for being a consistent member of our briefing panel as well. So we'd love to hear an update from you from a county perspective.
All right. Well, thank you very much, John. I do want to remind everyone that this is Census Day. And if you haven't filled out your form, please get it done today. I think this virus is a good example of how the federal government needs to know about numbers throughout the country. So please remember it's Census Day. I do want to update about the cases in Mecklenburg County, updating you, John, from what you said initially, that the number is now 24 more than yesterday. So we have 444 cases today. The next thing I want to say is Cabarrus County yesterday updated their stay-at-home order, making it more favorable to two groups that here in Mecklenburg that are struggling, and that's car dealers and realtors. And Cabarrus is now more in sync with other counties around the state. Our car dealers and our realtors have been struggling with this, and I know I have talked with numerous people in those two industries in the last 6 days. I can say that I did get an email from Dina this morning that she was going to try to get this solved, hopefully today, so that they can continue to function safely. So I was happy to hear about that. I do want to also say that I learned that when we have our board meeting on April the 7th, and it will be a remote meeting, we are going to have some opportunities to vote on some funds for small and micro businesses. You know, we hear a lot about small businesses, but that doesn't include the ones that are, you know, where you have 5 or 10 employees. Those are called micro businesses. And so I'm excited that we're going to vote on that, and I hope that that will happen. I feel like it will, and that will help these businesses with some funds before the federal dollars arrive. So they will kick in quicker, and that will hopefully be a bridge for them. So I think that's good news. I am getting a lot of calls from people who are trying to get things done and who are not internet savvy, and they're mailing things to government offices and that are closed. And I've been trying to address that in the last 24 hours. So we're trying to find some ways to get that corrected. But it's just people that are trying to, whether they're trying to get Medicaid or services for an elderly person. Anyway, so that is just a problem that has come up. And I continue to be worried about people with no access to the internet for jobs and services. I'm hearing from people that say, well, they hear about jobs, but they don't tell them how to apply if they don't have access to the internet. And so anyway, I just put that out there so we can all think about that. And I'll bring this up. I'm bringing this up with the county to see what we can do about that. I certainly have heard about, we have restricted more in our parks with basketball and tennis and different things where multiple touches on equipment. So we're trying to do better there. So anyway, that's my report from Mecklenburg County.
Thank you so much, Commissioner Cotham. We really appreciate your leadership, no doubt. So now we're going to go back down to, because the towns already gave their updates, we're going to go to CMS District 1 Board Member Rhonda Cheek, and I know she's on the call. Rhonda, I'd love to hear an update from you with CMS.
Thank you so much. So following the state guidance from the state board meeting last Friday, our schools are in remote learning, and we are going to be getting new materials tomorrow in our upper grades, and our elementaries and middles are going to be starting new material, fourth quarter material, on Monday. So I'm going to tell parents what they need to do is make sure they're continuing to keep the communication open with their families, with their teachers, and that they're getting their information directly from them onto what to do next and what they're supposed to be doing every day. It's very individualized based on where they are and what grade they're in. And the other thing is that the seniors are in the process of sorting through all of that with our seniors that were kind of deemed as completed with their coursework in March. Although I know most of them or many of them are still working on preparing for AP tests and completing other coursework right now. So right now, all proms in CMS are canceled. That was announced a couple weeks ago. Nothing's going to change with that. And as everybody keeps asking me, what about graduations? We would be hopeful that by mid-June we could still have our graduations as we always do. I'm sure we will not be shaking hands like we always do, but I do think if we can at all possible, we will do something to celebrate these the class of 2020 and all their accomplishments. And I know all the schools are hoping to have some kind of activities with them all united again as a class, since they all left school on March the 13th, not knowing that that was their last day together. So we are really mindful of that. I know that some of the mayors have brought up social and emotional health needs. We want to really make sure parents are being in tune with that with their kids that are home now, especially their older students that are really in a lot of stress and their worlds have really been turned upside down. I'm sure parents are feeling that way too. I'd ask everybody to have a lot of patience. I'm sure that at your households, you would all understand this, but I think most families out there have a lot more respect for what teachers do all day. And I hope that they will bring that forward when we all are able to reconvene in schools and take all that gratitude towards the teachers back to them. So that's really the big update. We did have our first virtual meeting yesterday. We had a little bit of a glitch. We used Zoom. Zoom was working great. The Zoom interface to Facebook Live was not working, so we ended up having to kind of old school it, but we were able to get the meeting broadcast live, and we will probably be doing that for the time being. And then the other thing is, if you are a CMS employee, please check your employee email. We've been working with the county and Commissioner Cotham. I appreciate that y'all have given us some leeway with leave, local leave, as well as state leave for our employees. I'm not even going to get into it. It's very complicated, and each employee has received a packet of information that they can go through and make decisions for their own situation. So there is leave packets that went out. Those emails went out last night and today. And that's about it for CMS right now. Business as usual, but at home.
Yeah, thank you. And really, my heart goes out to, I know your son Mason is a senior, and all the other seniors who, are missing sports and their proms. I mean, it's a terrible thing, but obviously it's the right thing to do. And I hope that when this passes, that something can be done and have the biggest get together for these seniors, because they deserve it. So anyway, thank you for the update, Ron.
They do.
You bet.
Thank you.
Now, yeah, of course. Now moving to the Chief Executive Officer of the Lake Norman Chamber of Commerce, Mr. Bill Russell. Bill, would love to hear an update from you, sir.
Yeah, John, I want to start off by thanking you for putting this together. I know what goes into a call like this and getting it facilitated and getting all the speakers together. And so thank you for putting this together. I've heard feedback on this. A lot of people are watching this video, and so thank you for doing this. I mentioned in previous emails about last Friday's Focus Friday. That has been stored on our website. If you go to lakenormanchamber.org, you can see that presentation that pulled together the Employers Association, which again is the larger, it's an organization that represents larger corporations' HR. So some of those corporations' questions were answered by Kenny Colbert. Mike Riley, who is the president of Huntersville Medical Center in Huntersville with Novant Health, Dina D'Orio with the county manager's office, We also had Eileen Joyce with the Small Business Administration. Again, that information is kind of long, but you can look at it. Some wonderful information on the Chamber's website. We also placed on our website a piece from the United States Chamber of Commerce. It's the Coronavirus Emergency Loans, the Small Business Guide and Checklist. Again, that's being stored on our website. It's a compendium of the CARE Act and a lot of the information out there that's really easy to follow. So if anybody has any questions about what's out there for small businesses, go to our website at lakenormanchamber.org. Tomorrow morning at 9 o'clock, Jay Leesman, who is a CPA in Huntersville and a past board chair of the Chamber of Commerce, is going to be putting on a program via Zoom on the Families First Coronavirus Response Act and what business owners need to know and do. He's also going to incorporate in that the CARE Act that just came out that everybody is very interested in. That's taking place at 9 o'clock, and it will be on Zoom. We've emailed that to our membership. A lot of people have signed up for that to take place virtually. However, we're also going to record it, and we're going to push it out in our email, place it on our website, put it on social media. So if you go to Facebook, you'll see that out there. So we're going to get that information out there as well. A lot of questions coming into the Chamber of Commerce about how they get information on these small business loans and employee information. Again, go to our website. We're trying to put all of that in a compendium on the website to answer the questions. And like you, John, I know you mentioned it when you first started this broadcast today. I listened to the President's conference meeting yesterday. It was very sober, very stark, hearing those comments that, we may have up to 250,000 Americans lose their life during this pandemic. And the next 2 weeks are probably going to be the worst. So like everybody on the call, please take great care, exercise social distancing, as Mayor Washam was saying, or Anarilla, I think, when you go to these big boxes, please keep your space. Make sure you're washing your hands, using your hand sanitizers, and be safe out there, because we want everybody to emerge from this. And we will get through this. And I think at the end of the day, when we do get through this pandemic, we're going to be a stronger community and a stronger nation. But thank you, John, for everything you're doing. And I hope everybody continues to support the businesses at the lake.
Thank you, Bill. Appreciate that update. I always have an open invite to our friends at the Huntersville Regional Chamber. Is anyone on by chance at the Huntersville Chamber? Anyone? Last call, Huntersville Chamber. Here's the website for the Huntersville Chamber, so we continue to reach out. Just have an open invite to that chamber as well. So we are stronger together, everyone. Our next briefing call, we do these every other business day, will be Friday, April 3rd. Obviously, every day, new information is available. So I just can't thank these panelists enough. I mean, these are folks who are taking time out of their days to help update the North MEC region. If you have any questions or want to have any input, please email lkntogether@gmail.com because we are stronger together. I want everyone to stay safe and healthy, and this concludes today's briefing call. Thank you for listening.